Hello, everyone, and welcome to our first in the series of webinars that we're going to be teaching over the next number of months. My name is James Meschino. For those of you who don't know me, after graduating in 1979, I went back to school part-time, did a master's degree in nutrition and biology. And in 1984, I started teaching nutrition courses at the Chiropractic College, and then a little bit later at the Canadian College in Naturopathic Medicine. I've published over 200 research review papers on nutritional medicine, and I've written 4 books, and I've done a lot of speaking on this subject. So I'm very happy to have you aboard. What I did as time went by is I sold my practice in 1996, started a company that eventually became Adeeva Nutritionals, and built a supplement line of products, a health professional line of products for practitioners to use with their patients, using peer-reviewed scientific studies and putting formulations together where you have ingredients and standardized dosages of things that have been used in clinical studies with humans to show that you can have true efficacy in helping to prevent and/or improve the management of certain health conditions. So that line of products became Adeeva Nutritionals. And in 2015, we actually sold the company to a large public company, but they kept me on as the chief formulator and as the chief educator. So I'm very happy to have the opportunity to share some of the most recent clinical studies that have been published to help support what the Adeeva product line does in terms of countering the aging process. That's what we're going to be talking about today, is how this factors into the aging process. And I'm just going to pause for 1 second. And make sure that we have everything lined up as we do. So here we go. This webinar today is about how the body's aging clock increases disease risk. So in other words, our innate intelligence, which is really spectacular, also has a flip side where there's an aging clock inside the body where certain genetic time bombs go off at predetermined points in time that set the stage for decline and decay and degeneration. This is a lot of what happens in aging, of course. So the same way that a woman knows that around age 50, she's likely going to go into menopause, this is something that's built into the body's aging clock. But there are many other little subtle genetic time bombs that go off behind the scenes that are not discussed very much, not recognized well enough in terms of the medical management of aging. And the evidence suggests very strongly, as I'm going to show you, that there are 7 different supplement combinations that if they're introduced into the person's life at specific points in their timeline, that can counter many of the genetic time bombs of aging to set the stage for maintaining a more highly functional body and mind for a longer period of time. And so as I built the Adeeva supplement line, this is research that I followed very carefully. I'm going to show it to you today, that the evidence over time has actually strengthened the contention that using targeted dietary supplements at certain points in your timeline can very much help to forestall age-related changes, reverse some age-related changes, and improve a person's quality of life, their healthy life expectancy, and the number of years that they're going to have a highly functional body and mind. So that's really what the seminar is about today. So we will get started. So what I'm saying to you is that in addition to eating healthy, which you need to do, exercising, which you need to do, avoiding known carcinogens, getting adequate sleep, controlling stress, and maintaining a positive attitude, getting regular chiropractic care, that there are certain dietary supplements that can do things that diet can't do, that exercise can't do, that adjustments can't do, that drugs certainly cannot do. And there are certain supplements within the mix of all the supplements that are out there in the world, just 7 of them in particular, that are emerging as very key interventions that combat age-related changes in the body's aging clock, which then help to maintain a more highly functioning body and mind for a longer period of time. So this gives you healthy life expectancy. The number of years that you can expect to have to be a highly functional individual, not just how long you're going to live, living at the end stage of life, if your memory is gone and you have advanced arthritic changes and you can hardly move and you have tubes from an oxygen tank stuck into your nose. I mean, you're alive, but it's not highly functional living. It's not healthy life expectancy, as you can truly appreciate it with the background that you have. So what I'm saying is that up to age 40, people pretty much can do whatever they want. They seem to get a free pass. But at age 40, certain genetic time bombs start to go off to set the stage for decline, decay, and degeneration. And there are targeted supplements that you can start staging it at certain points, which I will show you, that can help to combat those genetic time bombs of aging, so you don't get the downward spiral to degenerative diseases and degenerative changes and loss of functionality. So it's not that supplements are the whole story, but supplements are an important part of the story over and above a healthy lifestyle. And these supplements I'm going to talk about can do things that drugs cannot do. And so because drugs can't do this, it's not in medical education anywhere. So the responsibility really starts to fall to you to actually be the gatekeepers of preventative medicine. So the first genetic time bomb of major significance goes off at age 40, where you start to get joint cartilage erosion. So how does this happen? Well, you know that healthy joints have articular cartilage for shock absorbing purposes to maintain the joint space, all the great things that cartilage does. But when there's osteoarthritic changes, which occurs in the aging process, that you lose that cartilage and you can have bone on bone and osteophytes and spurring and inflammation, and you know all about osteoarthritis. A lot of what happens from a healthy joint to a deteriorated joint is simply that the body, this is not the only thing that happens, but this is a major part of it, that after the age of 40, the body's unable to make glucosamine the way it did when you were younger. So let's just revisit that pathway. So if this large cell is a chondrocyte, which is in the cartilage, these living cells in cartilage, like other cells, they have insulin receptors, and the glucose can get into the cell. And some of that glucose, of course, can be used to generate energy so the cell can stay alive. Some of the glucose can go down another pathway to form RNA and DNA material so the cells can reproduce. But some of the glucose in chondrocytes goes down the hexosamine biosynthetic pathway. And as that glucose now gets converted into these components of cartilaginous material, the proteoglycans, like chondroitin sulfate and hyaluronic acid and glucuronic acid and uronic acid, these are the constituents that help to maintain cartilage integrity. And this pathway gets interrupted after the age of 40. I'm going to show you exactly what happens. After the age of 40, as that glucose is trying to become glucosamine, it can go down this step from glucose to glucose 6 to fructose 6 phosphate, but then it has to go from fructose 6 phosphate to glucosamine 6 phosphate via the fructose amide transferase enzyme, which converts fructose 6 phosphate into glucosamine. And after age 40, this enzyme becomes much more sluggish. This is part of the body's aging clock. So now you can't make glucosamine nearly as well after the age of 40. So what normally happens is this glucosamine that you made gets acetylated to N-acetylglucosamine. And then some of that N-acetylglucosamine forms hyaluronic acid, a very important constituent of cartilage, because it has shock absorbing properties and it draws water into the cartilage as well. But some of that N-acetylglucosamine becomes N-acetylgalactosamine, and the N-acetylgalactosamine is required to make chondroitin sulfate. So as soon as you can't make glucosamine anymore at optimal levels, then you're setting the stage for less hyaluronic acid and less chondroitin sulfate synthesis. So here's what chondroitin sulfate looks like. It's a disaccharide. It contains glucuronic acid, also made from glucose, And this is the N-acetylgalactosamine. So when you attach these two monosaccharides together, you get a disaccharide. And chondroitin sulfate is a series of those disaccharides all linked together in a really long chain. And if you don't have glucosamine synthesis in the first place, you just can't make chondroitin sulfate the same way you could when you were younger. So this is what chondroitin sulfate is. It's a repeating disaccharide consisting of the N-acetylgalactosamine with glucuronic acid. And what it is in the cartilage is the structure. It's the mortar between the bricks. So the bricks of the cartilage are made of collagen and elastin fibers mostly. Those are the beams, but between the beams or between the bricks, you have the mortar, which is the chondroitin sulfate and keratin sulfate and hyaluronic acid. So the chondroitin sulfate really looks like the bristles of a bottle brush, which I will show you right now. So if you look at the joint cartilage histologically, you see here's the collagen fibers. They're the beams running in different directions. And there's also, elastin fibers in there as well that you don't see here. But between the beams, you have what looks like a bottle brush. You have this stem, then you have the bristles going along across the bottle brush. Well, the bristles are the chondroitin sulfate, and the stem of the bottle brush is a series of amino acid residues, mostly serine amino acid. And the body makes serine through the transsulfuration pathway, which we won't get into today. We'll look at that on another day when we do a more comprehensive look at osteoarthritis and other problems. And here's the hyaluronic acid. So remember that you need glucosamine synthesis to make hyaluronic acid and to make the bristles the bristles of the bottle brush here. So as soon as you're not making glucosamine sulfate nearly as well after the age of 40, then what happens is the rate at which the chondroitin sulfate gets broken down and the hyaluronic acid gets broken down is much faster than the rate at which you can synthesize it. So over time, the collagen fibers get closer together because there's less mortar between the bricks, and you start to get thinning of the joint cartilage. The other thing is that the proteoglycans, like when you have the chondroitin sulfate attached to the serine residues, you have a proteoglycan. Those proteoglycans also are absorbing water into the cartilage to give it some of the shock absorbing properties. So you're not just getting a thinning of the cartilage when the chondroitin sulfate disappears, but you're getting more brittle cartilage, which can chip and fracture more easily. So over time, you start to get erosion of joint cartilage. It's almost inevitable in every case. So what we see is that after age 40, it becomes extremely wise to suppress inflammation by having an anti-inflammatory diet. So why is that important? Because what you don't see here is that on the inside of the synovial membrane lining, there are white blood cells called monocytes. And after the age of 40, the monocytes, they start to morph into macrophages, and they start secreting more inflammatory cytokines and prostaglandins. And you can downregulate the inflammatory response of the macrophage by having an anti-inflammatory diet that's low in animal fat, where you're getting fish and getting the omega-3 fats and fruit and vegetables, legumes and nuts and so on. Having this anti-inflammatory diet has been shown to be helpful, even in patients with rheumatoid arthritis who become vegans. Very often a year later, their inflammatory disease is tremendously toned down just from that intervention. So it makes sense that as you get older to be on a more anti-inflammatory diet. But then you have to, the studies show that if you put glucosamine in, that 98% of it gets absorbed. So that's important. You have to be able to absorb what you swallow. And the glucosamine goes to the chondrocytes, and the chondrocyte can use that glucosamine in place of the glucosamine it used to make for itself to help maintain chondroitin sulfate synthesis and hyaluronic acid synthesis. So you don't have the joint thinning and cartilage degradation at the same rate. Now, a lot of companies combine glucosamine with chondroitin sulfate, and there's some evidence that chondroitin can work, but there's also some evidence that the chondroitin doesn't actually get absorbed. That what happens is the enzymes break the chondroitin sulfate down and takes the sulfur, and the sulfur actually has the therapeutic effect. So it's actually more therapeutic to combine glucosamine with natural anti-inflammatory agents like quercetin and bromelain and MSM, because they have a powerful effect on toning down the inflammatory component that occurs after the age of 40. So I like the combination of glucosamine sulfate with a natural anti-inflammatory. So let's look at some of these natural anti-inflammatories. Well, glucosamine sulfate itself has anti-inflammatory properties. Not only is it cartilage building, as you see in this review, but it decreases the secretion of inflammatory cytokines like interleukin-1, and it tones down the release of nuclear factor kappa beta. I will show you this in a diagram in a moment. But when nuclear factor kappa beta is released from the cytoplasm of the macrophage and it goes to the nucleus, it stimulates genes that cause a tremendous secretion of inflammatory cytokines. It causes inflammation to occur in the joint. So glucosamine, not only is it helping to maintain the joint cartilage structure, but it's also toning down the inflammatory reaction that occurs in osteoarthritis and in the aging process itself. So it's glucosamine sulfate is the only form of glucosamine in really good clinical studies that's shown improvement of pain and function, improving symptoms, especially in knee arthritis, where continuous administration for up to 3 years resulted in significant reduction in the progression of joint structure changes compared with placebo, as assessed by measuring radiologic joint space narrowing. In other words, 3 years later, the people taking the glucosamine, no further joint cartilage erosion on radiographs versus the placebo, where people with osteoarthritis yet continued joint space narrowing. Only glucosamine sulfate has been shown to stop that process. Nothing else. There are no drugs that can do it. There are no other supplements that can do it. So the two effects of reducing inflammation and maintaining joint cartilage structure, these two effects combined may suggest a disease-modifying effect that was postulated based on observed decrease in the risk of undergoing total joint replacement in the fall of a patient's receiving the product for at least 12 months. In other words, people on glucosamine sulfate who had knee arthritis were the ones that didn't continue on to need knee replacement surgery compared to the group that got the placebo. That's a huge disease-modifying effect. Has a great safety profile, and it's only glucosamine sulfate, the pharmaceutical grade of glucosamine, which of course we use, that shows these disease-modifying effects and is cost-effective compared to other analysis. And it's not, other forms of glucosamine don't have the same evidence behind them. It's glucosamine sulfate, because it has all these sulfur molecules on it, that help to make it highly effective. And because sulfur is such a great anti-inflammatory in itself, taking glucosamine sulfate with MSM is a logical thing to do, because methylsulfonyl which occurs naturally, has these great modifying effects on inflammation as well, toning down prostaglandin synthesis and other effects, where it also inhibits the release of inflammatory interleukin-6, tumor necrosis factor alpha. I will show you all these pathways, inhibiting the release of nuclear factor kappa beta, just like glucosamine does. So we have great experimental studies on MSM showing that it tones down monocytes and macrophages from releasing a lot of inflammatory cytokines. And a lot of human open trials show the same thing. Then we have quercetin, this flavonoid, that has amazing inflammation modulating effects. This 2016 review that I'm citing here, it inhibits the enzymes that produce inflammatory prostaglandins and leukotrienes. And in a 2-month study where they gave athletes 500 milligrams of quercetin daily, it showed that it decreased in their blood their C-reactive protein. So C-reactive protein is a biomarker of how much inflammation is being produced in your body at any given time. So in these athletes who are training pretty hard, their CRP levels actually came down after just 2 months of just quercetin supplementation. And because quercetin also inhibits xanthine oxidase, which is the enzyme that converts purines into uric acid, it may have implications in helping to tone down the arthritic condition known as gout as well. So let's look at some of these pathways where you have glucosamine sulfate, decreasing inflammation, as well as MSM and quercetin. So here's tumor necrosis factor alpha. So if this is a monocyte, it has these tumor necrosis factor alpha receptors on the surface. When TNF binds to the receptor, it stimulates this pathway that goes to nuclear factor kappa beta, and then it releases it, and nuclear factor kappa beta goes to the nucleus of the cell and tells the genes of the cell to produce inflammatory cytokines like interleukin 1 and interleukin 6 and other ones as well, and you get this inflammatory response. So the combination of glucosamine sulfate with quercetin and MSM, and we're going to see bromelain in a minute, tones down the tumor necrosis factor alpha stimulation. So you help to block this, and you block the release of nuclear factor kappa beta from going to the nucleus and upregulating the release of these inflammatory cytokines. This is huge. There are no drugs that do this. Are drugs that are like these biologics like Humira and Remicade, which have these dramatic effects that actually weaken the person's immune system in the process. So here you have natural modulating herbal and accessory agents like glucosamine and MSM that can do this in a natural way and just tone down that inflammatory response. So you look at quercetin, all the inflammatory effects, anti-inflammatory effects, decreasing all these interleukins, decreasing nuclear factor kappa beta, decreasing pro-inflammatory factors, and also prostaglandins. It's incredible. So again, quercetin and MSM, if you look at one large cell, let's say this is a chondrocyte on the body, here are sort of the TNF receptors. They'd be one of the receptors on the cell surface. And then you have this pathway over to nuclear factor kappa beta. It goes to the nucleus and it produces this inflammatory cascade. So you're blocking these effects with quercetin, MSM, and glucosamine sulfate. And then bromelain enzymes, the 2012 review on bromelain. So bromelain enzymes come from the stem of the pineapple plant. I'm sure you know that. It has, among other things, great anti-inflammatory effects. It's highly absorbable, gets into the body and produces its anti-inflammatory effects without any major interference from digestive enzymes that might break it down. And it has all these incredible therapeutic effects, including relieving osteoarthritis. But it has other incredible anti-cancer properties where it encourages certain emerging cancer cells to commit suicide. I mean, it's truly remarkable. So in our glucosamine joint formula, right, which we call Adëeva glucosamine joint formula, I put in the glucosamine sulfate with MSM, with quercetin, with bromelain enzymes. And the reason is that glucosamine on its own works. Glucosamine with chondroitin sulfate works. But it takes these things a long time before the person feels any really efficacy, like up to 12 weeks. But with the anti-inflammatory herbs, because it's suppressing inflammation so much better than what chondroitin sulfate can do, that it's more of a fast-acting glucosamine product where the person is feeling improvement right away, and you're getting a much better anti-inflammatory effect over the long haul with MSM, quercetin, and bromelain than you could ever get with chondroitin. So my feeling is that at age 40, because that first genetic time bomb is going off, where you're going to get joint cartilage erosion because the body can't make glucosamine as well because the fructose 6-amide transferase enzyme is not nearly as effective at converting fructose into glucosamine, that this is the time to start putting glucosamine into your body, as I did back when I was 40 years old. And you just need a low dose, maybe just 1 capsule, possibly 2 capsules a day to maintain joint cartilage integrity. But if a person already has osteoarthritis, then they're going to need 3 capsules a day. And if they're way over 200 pounds, they should be taking 4 capsules a day. If they're on a diuretic drug, they take 4 capsules a day. And the truth is they can take the total dose all at once. We used to think you have to take it in divided doses over the course of the day where you start to lose patient compliance. But the truth is the studies show that you can take 3 or 4 capsules of glucosamine joint formula all at once with food to get the absorption, and it's done for the day, and you get the therapeutic effect that you're looking for. So that the first genetic time bomb goes off at age 40. The second genetic time bomb in the aging process of great importance begins at age 45. It really begins in your mid-20s, but it becomes significant at age 45, and that is that you start to get a power shortage in your cells. And the power shortage starts to come, and especially it's really affecting the heart muscle primarily, because the heart has to beat constantly. When you go to sleep, the heart has to keep beating. There's no rest time for the heart. So the heart muscle it has to keep beating. So this power shortage really affects the heart in a significant way. And the power shortage is just simply that your body decreases its synthesis of coenzyme Q10. And CoQ10, as we will revisit here in a moment, is vital to convert food into energy in the mitochondria of the cell, where 98% of your energy is produced. You need coenzyme Q10, so you start making less and less of it. By the time you're 45 years old, the decline is quite significant. So the heart muscle now has more trouble generating ATP energy, so the heart pump gets a little weaker. And in behind the scenes, without even realizing it, even if you're a marathon runner, your heart is slowly moving towards congestive heart failure. Congestive heart failure is the leading cause of hospital admissions in people over the age of 65 years of age. And also, people's blood pressure often rises as they get older. Well, there's arterial stiffness, that's a factor. But the inability of the endothelial cells that line the blood vessels to secrete nitric oxide, which dilates the blood vessels, is another factor. In order to secrete that nitric oxide, you need coenzyme Q10. So as you get older, that lack of CoQ10 causes the heart muscle to get a little weaker. It has other effects too. The brain doesn't work as well. Tumors or immune cells don't work as well. But is the heart muscle is getting a little weaker, but also you're not secreting as much nitric oxide, so you don't dilate your blood vessels as well, so you get more resistance to blood flow and blood pressure starts to go up. The studies by Carl Folkers has shown that 75% of people with congestive heart failure upon muscle biopsy of the heart show a deficiency of CoQ10. And in the studies that we have, including studies from cardiologists and cardiology journals, people with congestive heart failure and or high blood pressure, when they're given coenzyme Q10, very often the heart muscle starts to come back and the ejection fraction's better. And their blood pressure, if they have hypertension, often starts to decline. Every case is different, of course, because there can be confounding variables. But let's look at the CoQ10 story. Let's broaden it out. So normally 98% of the energy in your cells is made when glucose and or fat and amino acids can get converted down to acetyl coenzyme A. But in this case of glucose, it becomes pyruvic acid. And then with pyruvate decarboxylase, you get the conversion into acetyl coenzyme A. It binds with oxaloacetate to form citrate. Now we're in the Krebs cycle. Now we're in the mitochondria. And in the mitochondria, of course, in the Krebs cycle, these intermediates are going around and around as long as you can keep getting the acetyl coenzyme A in there. And in the Krebs cycle, niacin and riboflavin in the form of NAD and FAD are plugging off the hydrogen electrons from these intermediates and taking them, of course, to the electron transfer chain. And then they shuttle the hydrogens down the electron transfer chain. And as they do that, as you go from higher to lower levels of energy along that pathway, energy is given off to produce ATP. So the ATP energy that the body uses to power all its biological machinery is made primarily in the mitochondria. You're shuttling the hydrogens down the different cytochromes. But notice, you need CoQ10 to shuttle the hydrogen electrons between complex 1 to 2 to 3. So if the CoQ10 synthesis drops off, then your ATP, so you can't shuttle the hydrogens down, so you can't produce ATP energy nearly as well, and you run into a power shortage in every cell in the body. But the heart muscle and the brain are tremendously impacted by this. And so as the heart muscle starts to struggle to pump, you get enlargement, you start to see these cardiomyopathies. And as the heart muscle struggles, fluids back up into the lungs, and you start to get fluid effusing into the lung space, and the person basically is drowning in their own fluids. And so the story is extended when you look at people who are on statin drugs, the drugs that lower cholesterol, like Lipitor and Crestor as an example, because this is the way the body makes cholesterol. When you eat saturated fat and trans fats and you turn on cholesterol production to transport that fat, in the liver cells, you're converting acetyl coenzyme A into cholesterol, very long pathway. But you can inhibit that pathway by the statin drugs, which block this enzyme, which is the HMG-CoA reductase enzyme. So you block cholesterol production. That's how the drugs work. But they're also blocking this pathway that goes down and along to ubiquinone. You go, what is ubiquinone? Ubiquinone is coenzyme Q10. This is how your body makes its own CoQ10, is using this pathway. So when you block the HMG-CoA reductase enzyme, you're blocking also the pathway to form CoQ10. And so now you're lowering cholesterol, but you're also creating a power shortage. Since the advent of statin drugs, have we seen a per capita increase in the incidence of congestive heart failure across the population? Yes, we have. Congestive heart failure has increased by 20% across the population on a per capita basis since the introduction of these statin drugs. Doctors are told in their literature, and pharmacists too, that if someone's on a statin drug, you put them on CoQ10 to compensate for the CoQ10 they can't make for themselves anymore. But this message often is forgotten about because doctors in medical school don't really study nutrition and nutritional medicine at all. So this often recommendation gets missed unless the pharmacist brings it up. So any patient you have on a statin drug is supposed to be on CoQ10 as a supplement. We'll come back to that. Let's look at, here's a recent study that sort of confirms what I'm saying. This was a 2018 study. It was a 12-year study on elderly Swedish healthy participants. They gave them 200 milligrams of CoQ10 a day and 200 micrograms of selenium. They gave them selenium as well because there's a heart disease called Keeshan's disease that is prevented and treated with selenium. So they decided to combine CoQ10 with selenium. But that selenium issue really occurs only in parts of the world where the soil is really low in selenium, like certain parts of China. So it's unlikely that selenium had the magnificent effect that we're talking about here. So after 12 years, right, in the 12-year analysis of it looked at cardiovascular mortality in the elderly Swedish population had been given supplementation with selenium and CoQ10. The present follow-up revealed a reduced cardiovascular mortality risk of more than 40% and a significant risk reduction in those with high blood pressure, ischemic heart disease, and impaired cardiac function and diabetes in the group that got the CoQ10 selenium supplementation. So they randomly chose over 400 elderly people living in Sweden, gave half of them supplements and the other half got placebo. 12 years later, they're saying it reduced their risk of cardiovascular mortality by 40%. And even in those with really serious comorbidity issues like high blood pressure, ischemic heart disease, impaired cardiac function, and diabetes, even these patients saw a significant reduction in cardiovascular death and morbidity. So, I mean, this is the most recent study. There are many other studies showing the dramatic effect that CoQ10 has on reversing congestive heart. I've had some patients myself where I've introduced it and they've done extremely well. But I like CoQ10 in conjunction with the herb Hawthorne. And here, because before we knew anything about CoQ10, Hawthorne was the go-to herb to use for these patients because Hawthorne contains these proanthocyanidins, or these sort of unique flavonoids that help the cells convert cyclic AMP into ADP. Well, in order to make ATP, you have to first have ADP. And so Hawthorne makes that pathway happen. And Hawthorne, just like CoQ10, increases the release of nitric oxide from endothelial cells in the blood vessels, causing dilation, so it helps to prevent high blood pressure from developing. And it can help to lower high blood pressure. The caveat with Hawthorne is that you can't use it in conjunction with digitalis or digoxin, so just hang on to that. Here's a 2013 review of Hawthorne and cardiovascular disease. I'm quoting now from the research study. Currently, evidence is accumulating from various in vivo and in vitro studies that Hawthorne extracts exert a wide range of cardiovascular pharmacological properties. Pharmacological, that's how powerful it is, including antioxidant activity, positive inotropic. What does that mean? It means that the heart muscle can get more ATP energy. That's what it means. Inotropic means more energy availability for the heart muscle to pump. Anti-inflammatory, anti-cardiac remodeling, anti-platelet aggregation so you don't form abnormal clots, vasodilation from the release of nitric oxide, an endothelial protective effect, reduction of smooth muscle cell migration and proliferation. That means that you're not having less atherosclerosis forming. A protective effect against ischemic hyperperfusion injury. When they do open heart surgery and they have to stop blood flow to the heart, when they reintroduce the blood flow to the heart, often a lot of free radical damage gets done to the myocardium. This helps to prevent it. Anti-arrhythmia effects, lipid lowering effects, decrease arterial blood pressure effects. This is unbelievable. And in clinical studies, the reviews of placebo-controlled studies have reported both subjective and objective improvement in patients with mild forms of heart failure, congestive heart failure, using the New York Health Association's staging from 1 to 3. So if you have heart failure, you are ranked according to the New York Heart Association's criteria as to how severe it is. And Hawthorne has been shown, and CoQ10 as well, to bring people back from mild to moderate congestive heart failure to much better functioning heart improvement, and lowering blood pressure and lowering cholesterol and triglycerides as well. I mean, this is incredible stuff that's not being used in conventional medical channels as it should be. And then let's revisit quercetin. We talked about quercetin in joint cartilage, reducing inflammatory responses in the joint structures that we have. But quercetin also lowers blood pressure. And if you read this article, it says it acts as an ACE inhibitor, an angiotensin converting enzyme inhibitor, helping to block the secretion of angiotensin which would normally cause blood pressure to rise. So it works almost like the ACE inhibitor drugs, but in a milder form, and it increases nitric oxide release from endothelial cells. So quercetin has this effect on helping to maintain blood pressure, and many studies have shown that the more quercetin in the bloodstream, the lower the risk, if you're following the population in these prospective studies, of developing cardiovascular disease. It also has this anti-inflammatory effect in the blood vessel wall. So I created Adëeva Cardio Essentials around this research, where you're giving people after age 45 CoQ10 with a standardized grade of Hawthorne. It can't just be Hawthorne just ground up in a capsule, because it's the proanthocyanidins, the flavonoids like Vitexin, that actually have the therapeutic effect. And then additional quercetin becomes required, in my view, as you get older. So at age 45, you would have somebody take 1 capsule a day. And remember that CoQ10 is fat soluble, so it has to be taken with a meal. At age 60, you should take 2 to 3 capsules a day, as I do, to maintain cardiac function. If the person's on a statin drug, it doesn't matter what age they are, they're going to need 3 capsules a day. If they have high blood pressure, you can help them lower their blood pressure by taking 2 to 3 capsules twice a day. And I've seen cases of dilated cardiomyopathy where we gave the patient 3 capsules twice a day, and they bounce back. And so dilated cardiomyopathy often occurs in fairly young patients, by the way, patients in their 20s, 30s, 40s, 50s. Anyway, this is, you may not want to dabble in this area, but for just general prevention of a decline in cardiac function and helping to maintain blood pressure as people get older, putting them on cardio essentials is a logical thing to do. You don't wait for the power shortage to become critical, and now the person has congestive heart failure. Almost everybody's going to run into that problem over time if you don't reverse the power shortage. At age 50, the next genetic time bomb goes off. The immune system becomes much weaker, and the detoxification enzymes in your liver become much more sluggish. So that results in 2 things happening, right? If your immune system doesn't work as well, you're more prone to more virulent infections that can end your life. People get pneumonia later in life and they die from it. A younger person gets pneumonia, they're probably going to survive because the immune cells are not nearly as effective. There's studies going on right now during the COVID-19 epidemic or pandemic showing that people with better nutritional support for their immune system are doing better. They're less likely to contract certain viruses and they're less likely to have virulent forms of it. Even in elderly patients, this seems to be the case. So we're waiting for more evidence to confirm that. But the evidence that we have so far is quite reassuring that if you have a stronger immune system, likely you're going to do better. But after age 50, you don't have a strong immune system, and I'll show you why. And as your immune system weakens, also the immune cells can't find cancer cells as well and knock them out, so cancer gets more traction. And also the liver is now not detoxifying carcinogenic material that comes from the environment and the air we breathe and water and everywhere else. We're getting carcinogens now in our body, but the body can detoxify most of them. But now you can't do it as well, so they accumulate and cancer risk now increases. So the reason that the immune system weakens as we get older is that the thymus gland undergoes involution. So normally the T lymphocytes that are made in the bone marrow, when they come into the bloodstream, they have to go first to the thymus gland behind the sternum. And the thymus gland sort of puts them through boot camp, secretes certain alpha globulins that make these immune cells very intelligent, and they become the quarterback of the whole immune system, telling the other immune cells what to do if there's an infection or if cancer is developing. So now these T cells are not nearly as intelligent because there's no boot camp for them to go through. So they become less efficient. And I'll show you how to bring the efficiency back in a moment. Also, the accumulation of free radical damage to immune cells over time also depresses their ability to function well. But antioxidants have been shown to help to preserve that functionality. And neutrophils, which are part of the innate immune system, which normally can find a virus or a bacteria or an emerging cancer cell, sort of engulf it, swallow it, and then secrete peroxides and blow it up. Well, the neutrophil's ability to create these respiratory bursts or create these peroxides is significantly depressed after the age of 60 in particular. But studies are showing that more vitamin C getting pumped into the neutrophil can actually bring it back to life and make it work better. Other things can weaken your immune system, certain kinds of drugs, people that are on prednisone or these biologic drugs for, Crohn's disease or psoriasis or rheumatoid arthritis, anti-rejection drugs, chemotherapy drugs. Certain drugs can weaken the immune system. Some people have to be on these drugs. I appreciate that. But people with compromised immune systems already, like patients with HIV, or if you're overtraining, if you're a diabetic, these are other things, right? Depression and stress. As soon as your cortisol levels are sustained at a high point or you feel hopeless or helpless, your immune system's weaker. Lack of sleep will do it. Ingesting alcohol, certain drugs, smoking, that'll weaken your immune system. Overtraining is one thing to exercise, but if you're overtraining, you're suppressing your antibody synthesis. Your beta lymphocytes can't produce antibodies nearly as well. And stress, of course, is a big factor. So here's some research to support what I've just told you on the immune system. But you'll see that after the age of 50, as the immune system is becoming weaker, cancer rates, this is colon cancer for men and women after the age of 50, just takes off. So does breast cancer for women and breast cancer mortality. And so does prostate cancer in men. These are stats from the UK, this particular graph, but it's the same thing in Canada. So it's not that you don't form cancer cells when you're younger, you do. But they can get a lot more traction once the immune system becomes more sluggish. And cancer cells can form more easily if you're not detoxifying carcinogens from the bloodstream as well. So after the age of 50, you have to modify these functions. So let's look at the phase 1 and phase 2 detoxification systems in the liver. So normally 2 quarts of blood go through your liver every minute of your life. And the phase 1 detoxification enzymes help to break some of those things down and convert them into intermediates, hand them to the phase 2 conjugating agents, which neutralize them so the body can excrete them through the fecal route or through the urine. So these 2 phases, step 1 and step 2, have to work sort of hand in glove in order to make the system work properly. Notice here the nutrients that are required for phase 1, the B vitamins and folic acid and antioxidants like vitamin C and vitamin E and the carotenes. This is why a high potency multivitamin is also very important lifelong, by the way. We'll revisit that at a later date. But notice the point I want to make right now is milk thistle. Milk thistle contains this flavonoid called silymarin, which is incredible at improving detoxification, protecting liver cells from many types of offensive agents, and helping to repair liver cell damage so liver cells can keep doing detoxification long into the twilight years. So milk thistle is a key nutrient to start using at least by the age of 50. And the nutrients for phase 2 conjugation, mostly for getting enough protein from your diet, you're in good shape. But certain phytonutrients, particularly from cruciferous vegetables, the indole 3-carbinol is incredible at improving detoxification reactions in the liver, has other great anti-cancer properties. So the nutrients of great importance after the age of 50 to support immune system function and detoxification are antioxidants, vitamin C for neutrophils and to slow down damage to immune cells. Selenium is needed for immune cells. Zinc is needed for immune cells. Beta carotene is needed for immune cells and detoxification. Of course, vitamin D and vitamin A, you know about that. But reishi mushroom extract gives the immune system back some of its efficiency that it loses when the thymus gland no longer is functioning. And same with astragalus, as I'm going to show you. And milk thistle for the liver and indole 3-carbinol for the liver to improve detoxification and preserve liver cell function after age 50 is invaluable. So let's look at some of this research. I'm saying that at age 50, over and above a high potency multivitamin with antioxidants and selenium and zinc and vitamin D and vitamin A, all that great stuff, that you start, it's a good time to introduce reishi mushroom extract. This is right from the WebMD website, talking about how reishi mushrooms are among several medicinal mushrooms that have been used for hundreds of years, mainly in Asia, for treatment of infections because it boosts immune system function. More recently, it's been shown as used as a treatment for pulmonary disease like infection of the lung and also cancer. Medicinal mushrooms have been approved, or they're approved adjuncts to standard cancer treatments in Japan and China for more than 30 years and have an extensive clinical history of safe use as single agents or combined. You can even use them with chemotherapy to improve the outcome for patients on certain chemotherapy drugs. So how do they work? Well, medicinal mushrooms, and reishi mushroom in particular, contain beta-glucans. It's like a type of polysaccharide. And in a lot of your immune cells are in the gut area, especially macrophages. And when you swallow those medicinal mushrooms like reishi mushroom, the beta-glucans actually enters the macrophages, a receptor for beta-glucans right on the macrophage cell. It's unbelievable. It's like it's made for it. And the macrophage ingests the beta-glucans. Then it goes into the lymph system and circulating throughout the body. And then the macrophage secretes little fragments of the beta-glucans that stimulate other receptors on other immune cells, like these are neutrophils, these granulocytes. And then the neutrophil can then stimulate function that'll knock out tumor cells, kill viruses more effectively. It just upregulates the whole immune cell. It's as if it went back to boot camp in the thymus gland, the rate of efficacy it's now working at. So once the beta-glucan binds to that receptor, it then activates incredible activity within immune cells, so they're secreting the kind of interleukins and immunoglobulins and cytokines they need to kill all kinds of pathogens, viruses, bacteria, fungi, other parasites. It is cancer cells as well. So medicinal mushrooms are hugely important. I would strongly recommend that you read these 3 references that I provided for you on medicinal mushrooms to develop a real appreciation for how important they are, especially after the age of 50. Then there's the herb astragalus, which contains active constituents that have been shown. Here's a 2020 review in the Frontiers of Pharmacology journal that summarizes the pharmacological actions of astragalus on, and I quote, immune regulation, such as enhancing immune organ index, promoting the proliferation of immune cells, stimulating the release of cytokines, and affecting the secretion of immunoglobulins, antibodies, and conduction of immune signals, anti-aging, anti-tumor by enhancing immunity. So it reverses the aging effect by getting the immune cells back into the fight, inducing programmed cell death of tumor cells and inhibiting the proliferation and transfer of tumor cells, has antiviral effects, regulating also blood sugar, type 2 diabetes, and other complications related to diabetes, even lowering lipids, having anti-fibrotic effects, antimicrobial activities, anti-radiation effects. Patients that are undergoing radiation therapy, if you give them astragalus, the secondary damage to their immune system is not nearly as bad. The immune system is maintained where it would normally undergo tremendous immunosuppression. There's all kinds of evidence to support astragalus as an immune modulator. So let's look at this. Here's a cancer cell under the electron microscope. These are cytotoxic T cells, part of the immune system, attaching to different receptors on the immune cell, secreting chemicals that will eventually blow the cancer cell up in 5 to 15 minutes. Every day of your life, cancer cells are forming, and the immune cells are finding it, knocking it out. But after age 50, this doesn't work nearly as well. Here's a macrophage cell. That's a cancer cell in the middle. These are little discs or macrophages binding to it, engulfing it, and destroying it. But for immune cells to do this kind of thing and to kill viruses and bacteria and fungi and parasites, the immune cells have to be primed with certain nutrients. So after age of 50, when the thymus gland is undergoing deterioration and your detoxification behaviors or activities are more sluggish, you need to prime them. So I created Adëeva Immuno Detox Prime that has Rishi mushroom extract at the standardized grade to get the beta glucans into the cells, and astragalus at the standardized grade that's been shown to be effective, and milk thistle using the standardized grade of Slimmer at 80%, and a pure indole 3-carbinol supplement. It's a 97% grade. So these 4 nutrients acting together help to support immune system function and help to maintain detoxification function within the liver. So for prevention, after the age of 50, you should take a couple of capsules a day. And you'll find if you're a person like myself that used to suffer from canker sores, that they virtually won't come back anymore. I was shocked to see that. And a lot of people have reported that to me. At the first sign of a cold or a flu, you should take 4 capsules twice a day. Also with Adëeva Oregacept capsules. The Adëeva Oregacept contains antimicrobial volatile oils like thymol and carvacrol that basically kill certain microorganisms on contact, almost like an antibiotic would. Now, if you're going to use Adëeva Oregacept, then you also have to take a probiotic with it because it will also kill some of your friendly gut bacteria. So that's sort of an aside. We'll revisit that some other time. People that are immune compromised, or they're cancer survivors, or they've undergone cancer treatment, they're going to need higher doses of these things. And I'm just going to highlight a product that we don't make that I think is also very good to add, especially during the pandemic. I've added this. If you go to mushroomharvest.com and you find their 14 mushroom blend, it's a powdered material, comes in a 1-pound bag. And having 1 or 2 teaspoons a day of that, I think, giving you a broader group of medicinal mushrooms, I think is also very complementary to the program that I'm showing you here. So that's at age 50. Then at age 55, the next genetic time bomb goes off. So what is that? That is, sorry, swallowed the wrong way. That is that you start to get into a decline in memory. So this happens because the brain starts to run out of the memory chemical, acetylcholine, after the age of 55. What happens essentially is that when you're younger, when you're eating certain foods, or say you're taking lecithin supplements, that the choline from food and supplements, the more you have in your bloodstream, the more of it can cross in the blood-brain barrier and get into the brain and become the memory chemical acetylcholine. Now, there's a transporter system that brings choline from the blood across the blood-brain barrier. But after the age of 55, that particular transporter becomes much more sluggish. And so you can't get choline into the brain nearly as well after the age of 55. Slowly over time, the brain uses up the choline that it has to make acetylcholine. And then after that, you start running into mild cognitive impairment. The person starts having seniors moments. They can't find words. They forget where they put their car keys and they forget people's names. And then slowly over time, it can progress into full-blown dementia and or Alzheimer's disease. So when the choline crosses the blood-brain barrier, it doesn't instantly become acetylcholine. The brain stores the choline by incorporating it into, in the outer part of the brain cell membrane, you have phospholipids, as you know. We'll revisit this in a moment. And the choline becomes incorporated into the phospholipids of the nerve cell membrane in the form of what's called phosphatidylcholine. And then the brain will take the choline as it needs it and convert it into the memory chemical. Now, what I'm about to show you, there are no drugs that can do what I'm about to show you. So here's how choline becomes acetylcholine. In just one simple step using acetyltransferase, you combine it with acetyl coenzyme A and you form acetylcholine. And then the brain also will break some of the acetylcholine down via acetylcholine esterase. So you have to keep making it. So notice also that serine can become choline, and that's what you're going to see shortly, that also giving the person supplementation that includes phosphatidylserine, which is also a phospholipid in the brain. But the serine component can also become choline, and then acetylcholine is also quite effective. Also, if you slow down the breakdown of acetylcholine, you can maintain higher amounts. And there's an herb called huperzine A that does that. So I'll show you how I combined all of these strategies into one formulation. So here is the nerve cell membrane, right? The biphospholipid layers that we studied back in school. And what do those phospholipids look like in the cell membrane? Well, they are a glycerol backbone. And on one carbon, you have a fatty acid. On another carbon, you have another fatty acid. And then in this case, you have choline. So this is phosphatidylcholine. Now, I'll bring this to your attention because I don't have a slide to show it. And we'll do another webinar just on brain aging because there's so much to talk about here. I can't do it all in just this 1 hour. But the more of these side chains of the phospholipid that are DHA, which is a fish oil essential fatty acid, docosahexaenoic acid, the more of DHA you have combined to this glycerol backbone with the choline, the better seems to be the improvement of memory. The more acetylcholine you have, the better are the phospholipids in the at producing signal conduction from one brain cell to the next. Memory is better if you have more DHA. That's what I'm saying to you. But Cdp choline is a form of choline that you can use after the age of 55. So what studies have shown that after the age of 55, just getting more choline into the bloodstream is not good enough because the transporter to bring it across the blood-brain barrier is not nearly as efficient. But there is a special form of choline called Cdp choline, cytidine 5-diphosphylcholine. It's naturally occurring. And when the brain takes choline, it converts it into Cdp choline on the way to making phosphatidylcholine, which I will show you shortly. But when you put Cdp choline in as a supplement, through a very complicated digestive and transport mechanism, which is beyond what I can show you today, but I will show it in another webinar. It increases the brain's Cdp choline levels. So you get that form of choline into the brain, and from there you can make phosphatidylcholine and more acetylcholine. So this form of Cdp choline has been shown to increase acetylcholine in the brain. It increases phospholipids of the brain. It increases phosphatidylcholine and phosphatidylethanoalanine, which is an important phospholipid in the brain. And these two phospholipids together increase cell membrane signaling, so the nerve cells communicate better with each other, better memory, better cognition. So once again, choline becomes acetylcholine, and remember that serine can also become choline. Back to Cdp choline. It is an efficient source of brain choline and aging, and it's been used successfully. It's not, doctors in North America don't use these things, as you know, but in other parts of the world where there's much more respect for naturally occurring substances, things like Cdp choline and glucosamine sulfate are actually drugs. They're actually on prescription. So they use Cdp Choline in Europe and in Japan to treat senile dementia, dementias related to cerebral vascular disease, in stroke recovery, early stage Alzheimer's disease, also concussion treatment. We'll do a whole webinar just on concussion at some point. It's an incredible form of choline that works. So I created this product that people should take after the age of 55 that contains Cdp choline with phosphatidylserine, bacopamoneary, which is what they use in India to preserve and reverse memory loss, and huperzine A, which slows down the breakdown of acetylcholine. So what I would say to you is, I've provided these updated references on how these things work and their clinical efficacy. I would suggest you read these research papers if you want to learn more. But if you just want to take my word for it, which you may want to do, if you don't have time to read all these papers, these are the 4 stellar agents that actually give the brain the chance to keep making acetylcholine, the phospholipids that they need, improve nerve conduction, slow down the breakdown of acetylcholine, that help to preserve and can restore memory when there's early stage memory loss. So how do you take this product? Well, from age 55 to 60, you probably just need 1 capsule a day. But because the acetylcholine tends to decline as you get older, once you're 60 to 70 years old, you should take at least 2 capsules a day. After the age 70, I would say 3 capsules a day. And if the person already has mild cognitive impairment, what I find has worked for them is taking 3 to 4 capsules twice a day, and their memory starts coming back. It may not work in every single case, but it'll work in a substantial number of cases, and the patient will be very grateful, or the patient's family. I suggest that you, after age 55, take that with 2 capsules of lecithin to get some additional choline, and also fish oil that has a lot of DHA in it, like the Adeeva Nature's essential oils that we make has a lot of DHA in it. 2 other anti-aging issues to deal with before we sign off. One is the male prostate gland, and the other is what happens in menopause for women. So let's deal with the prostate gland first. After the age of 40, a really serious genetic time bomb goes off in the male prostate gland. The male prostate gland starts converting more testosterone into a dangerous form of testosterone called dihydrotestosterone, or DHT. DHT causes the cells of the prostate gland to start dividing much faster. When they do that, the prostate gland enlarges and you get benign prostatic hyperplasia. And when cells are dividing very quickly, they make more genetic mistakes that lead to cancerous mutations. So cancer starts to increase in the prostate gland, and DHT causes those cancer cells to start dividing, so the cancer becomes a more lethal cancer. So there are some natural agents that have been proven to block the formation of DHT in the prostate gland as you get older, which have reversed enlarged prostate problems, and also have a modifying effect on prostate cancer. So let's look at this. Here's a cross-section of it. Here's the bladder, here's the urethra, and here's the prostate gland surrounding the urethra. So if the prostate gland enlarges, it's going to squeeze the urethra, so it's much harder for men to urinate, so they can't totally void the bladder, and they have all these signs of benign prostatic hyperplasia that are very troublesome. As men get older, the incidence of benign prostatic hyperplasia increases dramatically. So does prostate cancer after the age of 50, after the age of 40, but it really starts to escalate as men get older. So what you want to do is to use natural agents that are going to do the following: block the buildup of dihydrotestosterone, prevent too much androgens from getting into the prostate so you can't make as much DHT. Block the estrogen receptors on the prostate because estrogen slows down the breakdown of DHT. You also want natural agents that can get any cancer cells that are starting to form to commit suicide, apoptosis. And you also want to stop cancer cells, if they're forming, from forming new blood vessels so they can't spread and metastasize as easily. So there are no drugs that can do all of this, but there are natural agents in food, which we don't have time to discuss today, but also in supplements that can do these things. So here's the scheme on the DHT side. So this large rectangle is a prostate cell. And the testes produce testosterone, as you know, and the testosterone gets into the prostate gland and becomes dihydrotestosterone. And after the age of 40, this pathway goes much faster because this enzyme, which is the 5-alpha reductase enzyme, becomes more aggressive as you get older. It also becomes more aggressive in the liver. So you produce more DHT in the liver and you release it to the bloodstream. And that DHT damages hair follicles on the scalp, and men develop male pattern baldness from the buildup of DHT as they age. The problem is that the enzyme that converts testosterone into DHT in the prostate is not the same enzyme that converts testosterone into DHT in the liver. These are isoenzymes. So the herbs that I'm going to show you do a good job of blocking the DHT buildup in the prostate, but they don't do a good job of it in the liver, so that these herbs are not very good at slowing down male pattern baldness if it's occurring, unfortunately. But it works very well in the prostate. Notice that the adrenal glands also secrete androstenedione and DHA, and these androgens can also get into the prostate and become testosterone and become DHT. So you want to block, if you can block these androgen receptors, so less of that gets in, you're also going to make less DHT. The herbs that I'm going to show you also do that. And the herbs also slow down, the herbs I'm going to show you also block estrogen. Estrogen normally would slow down the breakdown of DHT. You want that DHT to be broken down. So you also want to block the estrogen receptors, which you don't see demonstrated here graphically. So I only have a limited amount of time today. I will do a whole other webinar just on male prostate health, but what I'm saying to you is that this combination of herbs, saw palmetto, these doses in standardized grades, Pygeum african, beta-cytosterol, soy isoflavone, stinging nettle, lycopene, these are the proven nutrients that block DHT, block the androgen receptors, help to induce programmed cell death of emerging prostate cancer cells. These are the dosages in standardized grades that have reversed benign prostatic hyperplasia and have helped to, in some cases, shrink tumor cells in men that have localized prostate cancer. So how could it induce programmed cell death? Well, if you stimulate some of these caspase enzymes, you can induce apoptosis of prostate cancer cells. Or if you upregulate the tumor suppressor gene P53, it will induce apoptosis by tearing apart the mitochondria. Certain herbs can do that. There are no drugs that can do this. And also, this is blocking tumor cells from getting more blood, so the tumor cells can't keep reproducing and then spread into the bloodstream and metastasize. Certain herbs can block angiogenesis. So some of those herbs like beta-cytosterol and isoflavones have been shown to do that. So that particular product is the Cadillac prostate protective product in the marketplace. There's no doubt about that. So the product's called Prostate 40 Plus. Here's how you use it. After the age of 40, take at least 1 capsule a day. I suggest you take 2 just to be safe. If the person already has an enlarged prostate that's mild to moderate, 2 capsules a day can help to shrink it. And you can use this product in conjunction with prostate drugs that do the same thing, so you can combine it. If they have localized prostate cancer, you can use 4 capsules a day as an adjunct of nutritional management in the case. And if they've already had prostate cancer treatment and they're survivors, they've had their prostate gland removed, they had radiation treatment, they should be taking it as well. Just in case there's some satellite prostate cells hiding, you want to cut off their access to DHT and encourage them to undergo programmed cell death if you can do that. So we'll have a whole other webinar just on prostate health at some point. In terms of women at menopause, I don't have time to get into the full story because we will have a webinar just on this. But remember that women, the hormone decline at menopause is very abrupt. A 90% decline in estrogen, and then progesterone at 66%. Even testosterone is declining. And you're getting the surge in follicle-stimulating hormone, luteinizing hormone, and then you get noradrenaline causing hot flashes and night sweats. It can be very uncomfortable. And with the drop in estrogen, you're also getting bone loss, decreased cholesterol receptors, skin atrophy, vaginal dryness, all these things. So doctors, of course, used to prescribe hormone replacement therapy, but now we see that it increases the risk of breast cancer and uterine cancer. So they only prescribe it now if a woman has really severe symptoms. And even using bioidentical hormones, we think poses the same risk of breast cancer. So in 80% of cases, not in 100% of cases, but in 80% of cases, using this combination of black cohosh, soy extract, and gamma rosinol that I put into women's hormonal balance can be highly effective in managing menopausal symptoms and supporting bone density to some degree, supporting vaginal function and less dryness. There's evidence, clinical studies to show that these nutrients at these doses and standardized grades can be highly effective. 2 capsules a day. May also be helpful for PMS, fibrocystic breast disease, and uterine fibroids. We'll revisit this at another point in time. Just remember that these herbs are quite dangerous. A lot of women turn to these herbs like Dawn Quay or Angelica species or red clover isoflavones or licorice root. They can help manage menopausal symptoms as well, but because they contain a lot of coumarins, it can lead to bleeding disorders or internal bleeding, which we have seen. And with licorice root, the glycerinic acid raises blood pressure. So you don't want to have these negative side effects of increased bleeding disorders and cardiovascular problems. So these are dangerous herbs for women to use. It's far better for them to use black cohosh, soy, and gamma rosinol if they can tolerate those herbs. Some women get headaches when they use black cohosh. Some women are sensitive or they have allergies to soy, so they can't use that. So, even in that combination, there are certain individuals that might be sensitive to it. But we'll have a whole other webinar on osteoporosis and women's health issues. I'll show you what those seminars will be. The next webinar that I'm going to do is on the supporting evidence as to why people should use a high potency multivitamin every day. That's the next one I want to do that you will see. And a high potency multivitamin, by the way, is one that is low in vitamin A because you don't want vitamin A toxicity, and has 10 to 15,000 IUs of beta carotene, 1,000 milligrams of C. It has the 400 IUs of vitamin E in the form of vitamin E succinate. That's the anti-cancer form of vitamin E, a B50 complex, 500 milligrams of elemental calcium. That's what people are missing. Low in iron. Has the 200 micrograms of selenium, and it has the zinc that you need, and the lutein for your eyes, the lycopene for your prostate and cervix, the chromium for glucose receptors. That's what a proper high potency multivitamin looks like. So the Adëeva multivitamin has all those things. So it's like 8 supplements in one. You don't have to buy all the different things. It's antioxidant enriched. It has the B50 complex. It gives you 500 milligrams of elemental calcium. And it has the vitamin E succinate, which is the anti-cancer form of vitamin E. We will look at that as a separate webinar down the road. I just want to put it on your radar because people should take a high potency multivitamin every day as soon as they reach adult life, along with essential fatty acids. And I like the Adëeva Nature's Essential Oils because it has borage seed, flaxseed, and a high-yield fish oil with lots of EPA and DHA, because you want to slow down cell division so you don't get cancer. You want the anti-heart disease effects. You want to keep your skin smooth. You want the anti-inflammatory effects. So it gives you this combination of all these benefits in sort of one capsule by combining borage with flaxseed with fish oil. We'll look at that down the road as a separate entity. So what I'm leading to is what the Adëeva Anti-Aging Supplementation Program is built around. So we've seen the updated research on what happens after the age of 40, but up to age 40, I think you should take a high potency multivitamin and essential fatty acids like the Adëeva Essential Oils product. Then at age 40 for men, because the prostate gland is going to start making more DHT and prostate risk goes up for enlargement and prostate cancer. This is when you start introducing prostate 40 plus, right then, to prevent it, as I have done. And then at age 40, because you're not making glucosamine the way you used to, and you're getting more inflammatory response from your macrophages in your joints, glucosamine joint formula is what you introduce at age 40. And then at age 45, when the power shortage begins, you want that combination of CoQ10, Hawthorne, and Quercetin to prevent congestive heart failure, keep blood pressure under control, decrease inflammation in the bloodstream. Cardio Essential is the product that is going to do that with the greatest efficacy. At age 50, as the immune system declines and your detoxification enzymes become more sluggish, that's when you want the Rishi mushroom extract, astragalus, milk thistle, the indole 3-carbinol from that product. And then at age 50, also, if women are going through having menopausal symptoms, they can use Adeeva's Women's Hormonal Balance. And then at age 55, this is when memory starts to decline. Less choline's getting into you're starting to deplete your choline pool. You have to get it back and preserve it. You need better nerve transmission. You want to slow down the breakdown of acetylcholine. Adëeva Memory Support Complex does that at age 55. And then throughout your entire adult life, depending on your blood vitamin D level, how much calcium you're getting from food, your risk for osteoporosis, you may need Adëeva's bone support formula at certain points along your timeline as well, depending upon the patient's individual risk profile. So when it comes to supplementation for healthy aging and to combat the genetic time bombs of aging, it's part of preventive medicine. Medical doctors aren't going to do this. Pharmacists aren't going to do this. Nurses are not going to do this. So it really falls to people who are engaged in complementary medicine to engage this part of preventative medicine. So with every patient that you see or client that you see, you want to look at their age and say, what genetic time bombs have gone off so far? And are they, are they a male or a female? Do they have a prostate gland? Are they going to go through menopause? What else? What are the gender-specific things I should also be looking at? So what should I be teaching them about the genetic time bombs of aging that have gone off so far in their body? And what supplements should I be recommending to them to counter those genetic time bombs as I have done? And then if they have a particular health condition over and above that, like high cholesterol or recurrent urinary tract infections, or they have an autoimmune disease, what other supplements might I recommend along with my dietary and lifestyle advice? But you always start with, where are they in their timeline? What genetic time bombs have gone off that are leading to decline, decay, degeneration that are likely going to catch up with them, right? So you need to standardize the science of supplementation if you're going to